It has infected 75 million across the globe, and it has taken the lives of 32 million, as stated by the World Health Organization August 19, 2019. It is the AIDS epidemic. AIDS is a well-known disease which has affected several individuals worldwide. AIDS can often be life-threatening and does significant damage to one's immune system. This makes it extremely hard for those affected by it to live what we consider a normal lifestyle. A family member of mine suffers from this life-altering disease, so I've seen the effects of it firsthand and therefore have some prior knowledge to this subject. So the question is, what is it? How was it contracted? What are the effects and the symptoms? Is it treatable or manageable? So what is AIDS? AIDS, otherwise known as acquired immunodeficiency syndrome, in its early stages is called HIV, which is otherwise known as human immunodeficiency virus. HIV is an STI, otherwise known as a sexually transmitted infection, which most of us know. It attacks the body's immune system, making it difficult for the body to fight diseases and infections. According to the website for the Mayo Clinic, February 13, 2020, HIV left untreated results in AIDS within about 10 years. So how is HIV contracted? As I've previously stated, HIV is a sexually transmitted infection. Though this is true, it can be spread in a variety of other ways. Unprotected sexual contact with an HIV-positive person is arguably the most common way it is spread. Other than this, sharing needles for drug injection purposes is another big one. An article on HIV.gov, June 24, 2019, states that a mother can pass HIV to her child during birth, but this can be prevented by medication administered to the mother during her pregnancy. So what are the effects and the symptoms? The early symptoms of HIV can vary, and the timeline they occur in can as well, depending on the person. According to NICHD.nih.gov, December 1, 2016, upon early infection, people may experience flu-like symptoms such as fever, headache, fatigue, and enlarged lymph glands in the neck and the groin. This website also states, however, even if people with HIV feel healthy, HIV is still affecting their bodies. Once HIV enters the body, it infects large numbers of CD4 plus cells and rapidly spreads throughout the body and into many organ systems. Once HIV progresses to AIDS, the symptoms become more prevalent and overall more serious. We now know that AIDS is the late stage of HIV. The Mayo Clinic website, February 13, 2020, states that when AIDS occurs, your immune system has been severely damaged. You'll be more likely to develop opportunistic infections or opportunistic cancers, diseases, that wouldn't usually cause illness in a person with a healthy immune system. The Mayo Clinic also gives us a list of symptoms likely with progressed AIDS, such as sweats, chills, recurring fever, diarrhea, swollen lymph glands, white spots or lesions on the tongue or in the mouth, fatigue, weight loss, and rashes. These won't occur in everyone with AIDS, but these are the most common symptoms that people experience. So, is AIDS and HIV treatable and manageable? Treating HIV early is important in slowing down the virus, but there is not yet a known cure. The website for the Centers for Disease Control and Prevention, October 17, 2019, says, HIV is a type of virus called a retrovirus, and the combination of drugs used to treat it is called antiretroviral therapy, or ART for short. Although a cure for HIV does not yet exist, ART can keep you healthy for many years. ART reduces the amount of virus, otherwise known as viral load, in your blood and bodily fluids. Several medications are available to help contain and slow down the virus, but there is not yet a known cure for HIV or the progression of AIDS. It is not hard to see how life-changing and complicated this disease truly is. It has different stages, elements of complications, and presents a wide variety of different symptoms. Though it is scary and can be life-threatening, We now know that there are precautions that can be taken to avoid infection of this disease.